Hello there, my name is Rafael Curiel, City of McAllen Employee Wellness Coach, and I'm joined today by some of the best people that you're going to find at helping to alleviate pain, muscular joint pain. And this is a webinar or a session being put together by Airrosti. We're joined here by Juan Gaona, Dr. Rene Ramon, and Certified Recovery Specialist Rick. They're all in the house today to tell you about the foundations of fitness. So with that, I'm going to go ahead and turn it over to Juan, so he can get us going with this awesome bit of information for you today.
Thank you, Rafael, and thank you for everybody else for jumping on this webinar. Like we said, my name is Juan Gaona. I am the Regional Account Manager for Airrosti Rehab Centers. Some of you might remember me from past lunch and learns that we've done in the, with the city. Real quickly, I always like to start off my presentations with a quick what is Airrosti. So Airrosti is a healthcare group of providers that specialize in resolving soft tissue injuries. So anything like low back pain, shoulders, knees, hips, bottom of the foot pain, we can take care of for you pretty quickly in an average of about 3 to 4 visits. No injections, no medications. Like I said, we treat everything from head to toe. The doctors use their thumbs to work through the fascial tissue to kind of get everything moving in the right direction. What I always like to tell my patients when they come in is you're going to learn 3 things when you come to Airrosti. What happened, how it happened, but most importantly, how can you prevent this from happening again? That's kind of what we're going to focus on in this webinar, Foundations of Fitness. We're going to go over a couple of movements that a lot of you might be doing at home just because of due to COVID-19 that we all have to shelter in place. We still want to get those workouts in. We want to make sure that you're doing all of these exercises correctly and making sure that if you have any questions or anything that come up, we can answer them for you. So real quickly, just because of COVID-19 and doing things through webinars, due to the unique nature of an online teleconference platform, we ask that you please refrain from sharing any specifics about your personal health information. So I know this is going to be put onto a live feed, so just make sure you don't comment anything about your personal health on there. We don't want everybody seeing that. If you have any questions that you want to ask me personally, you can always email me at juan.gaona@airrosti.com. Okay? So we'll continue going to the next one. So like I mentioned, we take care of all types of soft tissue injuries. This is a good little list right here of the things that we treat in the office. We're definitely not limited to this list. So if in case you don't see something that you have going on here, doesn't mean we don't treat it, just basically means we didn't have room for it on the list. So our doctors use specific orthopedic, functional, and neurological tests to determine what the root cause of your injury is. I always like to use the back as an example. There's many reasons why we have back pain. Could it be a hip flexor issue, a true injury to the back, sciatic pain, things like that. But our doctors are trained on how to figure this out. So in case you have questions or in case something comes up where you're thinking, I don't know about what I have or if I should get treated, there's always a good thing to come in and go through the assessment with us. So on that note, real quickly, we're going to have complimentary virtual injury assessments on Thursday, November 19th from 1 to 3. This is going to be with Dr. Ramon. You can do these in person at the office or virtually. If you feel like you want to do it through virtual, you just have to scan this code right here and they will send you the registration link and you can register through there. Just make sure you let us know if you're coming into the office or you're going to do it virtually so that the doctor's ready to see you. Alrighty, so back to our presentation, like I mentioned about Foundations of Fitness. We're going to go joint by joint approach. Dr. Ramon's going to talk to us about the different joints that need to be stable versus those that need to be a little bit more mobile. We're going to go through the movements with you. Rick right here is going to go through the movements, and we're going to talk about what is painful versus what is non-painful movement. We're definitely going to walk you through the exercises step by step. We're going to go through some modifications. So in case you're watching this and you want to join us, go ahead and follow along. And then we'll talk a little bit about Airrosti towards the end, okay? So what I'm going to do is I'm going to pass it on to Dr. Ramon, and he's going to go through that joint by joint approach. All yours, Doc.
Thank you guys for having us. We are talking about joints here today. Now, some joints need to be stable and some joints need to be mobile. Okay? Basically, that means it almost says it, what it means in the word. You know, when you want a joint to be mobile, you want it to be very flexible, very loose, able to move in many directions. Okay, we want something that's very stable or stability. We're looking for a joint that's not going to move very much, something that's going to be a little bit strong and supportive here. So just kind of using Rick right over here to go over some of the examples of areas that should be nice and strong and stable. Those are going to be joints that really don't move all that much, okay, or they're very kind of limited in their range of motion. So for instance, the elbows right here, when we're talking about this arm right over here, The elbow really can only almost exclusively just move in two directions. When you compare that with the mobility of the shoulder, that can move in many directions right there, and the mobility of the wrist, another joint that can move in many directions. So we're looking for mobility here, and we're looking for strong stability over here at the elbow. Okay. So when it comes to the lower back, we're going to turn Rick right around here just a little bit. It's another area that we want to be very stable right over here. We also want a nice stable lower back. Some of the exercises that we're going to do today are going to help you achieve that. Okay. Turn around right there. And coming back to another joint that we want very strong and stable is going to be the knee. Pretty much the knee can only flex and extend. Okay? It can only go in two directions, really. So we want this really, really strong right over here. And we compare that to the hip and the ankles right over here. The hip, we're going to see in a little bit on an exercise how many directions the hip can go, and also how flexible that ankle is right there. So basically, we want some joints really strong. We want some joints very flexible and very movable right over here. So some of these exercises are going to help you with that. Okay. We're going to start out with our first one right over here, and Rick is going to help us demo. So we're going to start out with the forearm plank, and Rick's going to go and get started out with, just on his tummy right over here. Go and start out flat right there, Rick. Go show them how to lift themselves off the ground here. So Rick's forearms and everything is nice and in line right over here. He's going to want his elbow right over here underneath his shoulder, okay? And he's going to go and tighten up his core, okay? So you want to tighten up the core right over here, which are basically your abdominal muscles, your lower back muscles, and even you want to tighten up these glutes right over here. He's going to go and push himself off the ground and put himself in this plank position. So we call this the forearm plank. His elbows are a nice 90-degree right over here. We got a little 90-degree angle going on right over here with the shoulder and the torso. And everything is straight. It's like a board. It's like a plank. But for the most part, Rick is pretty straight right over here. Some of the things that can go wrong in this particular exercise is he could dip. He could dip a little bit right over here and have an arch in that lower back. We want to avoid that as much as we can, okay? But for the most part, we want to keep it nice and straight right over here. Some of the things that you want to look out for is some pain in the elbow. If you're having some dysfunctions, you want to look out for pain in the elbow, pain in the shoulder right over here. If your core's not strong enough, it's going to dip right over there. That can cause some lower back pain. We can even have a little bit of pain pulling through the quad muscle right over here. But that's that muscle on the front of the thigh that can get a little bit tired from this one. Now, if that's the case, we want to do a little modification with this. So what Rick's going to do is he's going to get himself on his knees right over here. That's going to take a lot of body weight off of the shoulder, forearm, and the elbows right over here. So it's much more stable in this position. It's much easier right over here. So what you're going to want to do is if you can't do the regular plank, you're going to want to do this modification right over here. And the same will apply, keeping the core tight, keeping your glutes tight right over here as well. Okay. Next one, guys. This is another core work exercise right over here. And this is a side plank. So what we're going to want to do right here is start out laying on your side. Your feet are going to be stacked on top of each other. Legs are stacked on top of each other. Rick's got his elbow right over here and forearm on the ground directly underneath the shoulder. And what he's going to do is hand on the hip right over here. That's going to support him. He's going to tighten up his core again. He's going to tighten up his glutes, and he's going to go and lift off the ground. Again, he's in a plank position right over here where he's relatively straight right here, which is good. Sometimes if you're not tightening up your core enough, then you're going to find this dip again right over here, this little sag right over here. So you're going to want to keep yourself pretty straight to achieve this exercise. You can hold this for 15 seconds, 30 seconds, and a minute. I forgot to say that about the previous exercise right there. Whatever you can do is fine. If you have some trouble with this, if you find that you have some low back pain, some hip pain, or some elbow or shoulder pain, or even neck pain right over here, you're going to do the modification, which is going to be the side plank off the knees. We're going to keep our knees right over here in contact with the ground, and then we're going to go into plank again. There's much less body weight applied to the shoulder and the elbow right over here. And again, you want to hold this for a few seconds. Minimum 15 seconds you want to try to get to these. I'd say a maximum for these kinds of things is going to be a minute. Okay? Very good. Next one, guys, is a push-up. I think a lot of us know how to do a push-up, but we're going to show you some of the fundamentals of this right over here. We're going to start out flat on your bellies right over here. Okay, we call this the prone position. Okay. So we're going to keep our feet right over here, pretty tight right over here. Secure this right here. Rick's elbows are, or excuse me, his hands are right underneath his elbows and his shoulders, just all in line. His fingers are facing forward. And he's going to go in again, tighten up his core, his glutes, his quads, and he's going to go and push himself up. There we go. We want to go nice and slow on the way down on that push-up right over there, okay? So this is a great chest exercise right over here. It's also a good exercise for our mid-back as well, including the biceps and the triceps, okay? Let's go and try that one more time, Rick. It's similar to the plank, guys, and we're looking for problems that can happen with this particular exercise, which we can start to have a little bit of a dip right over here. If you notice your lower back, just extend with this extension right here, arcing back, your belly is going to hit the bottom of the floor right there. You're not quite getting that exercise. Once you want to have your chest right over here, centered up, hitting that floor, and then coming back up nicely. But we have some issues with lower back pain, elbow, or shoulder pain. What we're going to want to do is do a little modification and use the knees as our contact point on the ground instead of our feet. So we're going to go ahead and do this push-up from the kneeling position right over here. And it's much easier to do, okay? And so this is a great progression right over here. If the push-ups are too much for you, if you have pain, or maybe you haven't done push-ups in a long time, and you're just not quite there yet as far as meeting your fitness goals, you're going to want to start with something easier right over here with using our knees and doing that push-up, okay? Very good. Next, we're going to go ahead and do a shoulder press right over here. And to demo this, we're going to use our little PVC pipe right over here. And of course, if you're at the gym, you could use a 35-pound bar, a 45-pound bar. And of course, if you're strong enough and if you've already passed all that, you're going to be able to do this with some actual weights and plates or bumpers on the bars. For this one, we're going to start nice and even right over here. The bar should be resting right over here. Hands are going to be in this nice extended position right over here. And Rick's going to tighten up his core, his glutes right over here. And he's going to go just push straight up for us right over there. Very, very good. And he's going to bring it straight down right there. That is our shoulder press right over here. Okay, nice. And it's just straight up, guys, right over there. If you have too much weight, sometimes you're going to want to tilt back and almost do a bench press position right over there. If that's happening to you, you're going to want to modify that and just scale down on the weight that you're doing. Okay. The wall angels. If that's too much for you guys, if you don't quite have that on the form, or if you're having some neck or shoulder problems, even elbow or wrist problems, because that can be an issue sometimes in this exercise, we're going to do a wall angel, and Rick's going to demo this wall angel right over here. Very simple right over here. You're just using your own body weight. You're raising your arms right here. If he would be up against a wall, we can't really show you because of our camera angle right over here, but Rick would be flat up against the wall right over here, and his hands and arms would be in contact with the wall. He's just going to pick himself straight up right over there, and he's going to complete the rep, okay? So this is a really good upper body exercise right over here that builds strength from those shoulders. A lot of times we see patients with shoulders that come into our office, so this is a good exercise for them, okay? Next, guys, our fifth exercise we're going to show you all today is a lunge, okay? And this is the forward lunge right over here. So we're going to start with our feet shoulder width apart, basically hands on the hip right over here. We're going to lunge forward with one leg. So Rick is going to step forward with one leg, contact the ground, and it's going to come straight down. On this one, you're going to want to think about dropping your bottom straight down to the floor versus thinking, pushing your body weight too far forward right over there, because that we don't want to do. We can lose our balance. That's a little bit too much work on the quads. These muscles right over here in the front, they get enough work as it is already. So we're going to try that one more time, Rick. There we go. Knee contacts the ground, and then we just prop ourselves back up. You want to do this nice and slow, guys, right over here. If this is too much for you, maybe you don't have the ankle mobility. Maybe your knee hurts every time you contact the ground, okay? Maybe you've got some lower back pain or hips. We're going to do a reverse lunge, and this is a little bit easier for us to perform. It's easier on the body. We're just going to step back, drop that knee down right over there, and then come back up. It's a lot easier to do this particular exercise right over here, okay? Very good. And the same thing applies. You want to tighten your core before all these exercises and engage that core right there. All right. Squat is next. Our sixth exercise today is our squat right over here. It's a great exercise. It tells us a lot of information as to the body right here. Rick's going to go and start out with his hands down by his sides right over here. And all you're going to do is keep your feet shoulder width apart, a little bit shoulder width apart there. You're going to point your toes outside just a little bit. And all you want to think about doing is just dropping your pelvis down to the floor right over there without coming too far forward right over here, okay? Some of you are not going to be able to do this with keeping your feet flat on the ground. Sometimes the heels will come up off the floor. That means you're real tight on the back side of the body with your calves or hamstrings or your glutes or your lower back. Or maybe you have too much tension over here in the front with the hip flexors, okay? So a modification for that is a hip hinge. And we're going to give Rick the PVC pipe again. A little bit of a hip hinge, very safe, very effective kind of exercise right over here. He's just going to drop that bar to about the knee level, and he's going to come back up. Most of the range of motion is happening right over here at the hips. Very, very good exercise. You'd be surprised at how often we don't use our hips. We just use our quads a little bit too much during the day when we go from a seated position to a standing position right over there. You don't need a bar to do this one. If we take the bar away from Rick, he's just going to do it without the bar right over there. And it's very simple. He can do that without the bar. Okay? All right. And our last one, guys, it's exercise number 7, our 5-point hip range of motion right over here. The hip is one of those joints that it's got a lot of range of motion. It can go in many directions, okay? So first we're gonna go and start out with something called fire hydrants, okay? So we're gonna be on our hands and knees right over here, nice and square. Knees underneath our hips, hands underneath our shoulder right over here. And all Rick is gonna do, he wants to bring his hip out this way, okay? So you're just, we call this lateral flexion. This is bringing that hip towards the outside part of the body right over here. The reps, you can do 2 sets of 10 of this, a day, and that's a really good exercise. It's another body weight exercise right over there for us, okay? That's one range of motion that the hip does have. We're gonna do something called donkey kicks next, okay? And on the donkey kicks, you start out in the same position right over here. And all Rick is gonna do is going to extend that hip. He's gonna keep this knee at 90 degrees right here. And that is a donkey kick. I guess if you can imagine a donkey kicking somebody, that's what it would do right there. But we're gonna do one side at a time, okay? And there we go. And nice and slow. You want to be slow with some of these movements right over here. You're not in a hurry to get these done. You want to count maybe 1 to 2, maybe 2 to 3 Mississippi to complete some of these motions. If you go too fast, it's not going to be as effective as it should be, and that can cost you your form in the exercise right there. We're going to do some hip circles. We'll do forward hip circles right over here. And these are great because the hip is able to perform the circular motion, okay? So this is a combination of internal and external rotation right over here with the hip, which is really nice. You're just gonna make a forward circle with your hip right over there, okay? We're gonna go ahead and do hip circles backward now. Rick's gonna go in the opposite direction. He brings that hip forward and then circles around to the back. And that's a nice healthy exercise for that hip, especially for the glute and the hip flexors there. So again, a couple of sets of 10 doing this on a daily basis is a really good thing. And lastly, we're going to do a lateral leg lift, which can be done standing up. We're going to show you the standing version right over here. It's the simplest way to use your body weight. You're just going to take your hip and we're going to lift that leg out this way to the side, okay? So these are great body weight exercises to do right over here. One, you might have some hip, some hip tenderness right over here. Those are some things to look out for. I do really want to stress to you guys, if you feel some sharp stabbing pain during some of these exercises, that's a stop sign for you. You don't want to push through that, okay? So you want to modify it like we've shown you how to modify and see if that takes away the pain. If it does not, you might have a condition, and that would be a great opportunity for you to talk to us about that particular condition. We can discuss that. But for the most part, if you can't do a particular exercise, you think it's not safe for you, or if you're having some pain, you want to modify like we've shown you, and that should help, okay? So the idea is to not do anything that's painful for you, basically, okay? So you're going to use common sense with those particular exercises, okay? And that's it for hip hinge, guys. That's our 7th exercise that we're showing y'all today.
Sounds good. Thank you, Dr. Amon. Thank you, Rick. It looks like Rick got a good little workout / warm up there, huh?
Yeah, he's hot, man. He's on fire right now.
So, I mean, and again, this was the point of this quick webinar, quick, Foundations of Fitness talk. We wanted to make sure that you get the right information on how to properly warm up, Like I mentioned, now we are working, a lot of us are working now more at home now, so this is a good starting point for a lot of us, especially with the squats, the lunges, the push-ups. It's always good to know what we should do and what we shouldn't do. And like Dr. Ramon says, our body's talking to us. It's letting us know when it's giving us this kind of pain, we need to scale down a little bit, the weight, or even modify the movement like Rick was able to do. Good. So just like I said, we're going to talk a little bit about Airrosti really quickly. So our clinics are currently open. These are our locations right here. So you can see that Dr. Ramon is in Airrosti, Edinburgh. We're right off of Trenton. We also have an office in Harlingen off of Hales Avenue. And then we also have a clinic in Brownsville off of Alton Glore. We are following all CDC guidelines. So in case you want to know what we're doing is we're making sure that we're taking everybody's temperature when they come in. We are doing a thorough background, just making sure that the person that's come in hasn't had any contact with anybody with COVID-19. And then in the office, we are requiring all patients to wear a mask. Plus, our employees are all wearing masks as well. And we are sanitizing after every single patient that comes in. So we're taking all the necessary precautions. We don't really want COVID-19 to be a reason why you have to be in pain from here on out. We want to make sure you can still be able to come in and get treated. Real quickly, I want to say thank you for jumping on this call again with us. Like I said, stop living in pain today. If you want to make an appointment, you can call us at 1-800-404-6050, or you can even just go on to airrosti.com. It says right there, schedule an appointment now. Click on the information, and then we'll contact you. I know we went through a lot of, like I said, of exercises and stretches. If for some reason you have any questions, you can direct them to me at juan.gaona@airrosti.com. Send me an email. If I can answer the question for you, I will. If not, I'll forward on that to Dr. Ramon, and we can get everything straightened out for you.